Hello, and thank you for joining the patient-focused presentation, How to Become Involved in Your Facility's QAPI Meeting. In this presentation, the focus will be on why your voice as a patient is important in your facility's quality improvement, who your facility can choose to be part of a meeting, including yourself, what areas or topics you can report on in the QAPI meetings, and the various ways of how you can be included in the facility QAPI meeting. So you might be wondering, what does QAPI stand for anyways? QAPI stands for Quality Assessment and Performance Improvement. This meeting is held every month at your facility with members of the healthcare team. These members may include the facility medical director, facility manager, nurse, social worker, and dietitian. They discuss the facility health metrics and goals, network projects and activities, and they may also talk about reported patient concerns and grievances. Why would we want patients in the QAPI meeting? Centers for Medicare and Medicaid Services, otherwise known as CMS, have always stated the patient voice is a very important part of facility culture and quality improvement. You, the patient, give the patient perspective and expertise on facility activities, and you are given the opportunity to discuss concerns about the facility other patients may have mentioned but have not been brought to the attention of the facility manager. If you have ever been interested in being a part of QAPI, there are a few things facilities look for when choosing a patient. As a default, patients who have been assigned as the Patient Facility Representative, or PFR, may already be part of meetings reporting on facility activities and ongoing network projects. Other qualities include showing concern for multiple issues and being able to look beyond your own personal experiences. Facilities look for patients who have active listening skills and keep a positive attitude. They enjoy interacting with other patients, and they can speak openly in a group setting. So we have already discussed the topics the healthcare team talks about, but what do you, the patient, want to talk about? Here are some topics you can report on. Patient feedback and input is asked for. Activities of the quality improvement projects at your facility, maybe any new resources being developed, development of lobby days, putting bulletin boards together with educational tools, talking about the barriers and accomplishment with your facility activity you may be involved in, facility concerns reported by other patients, and information and resources given by the network. We love when the patient can be the bridge between the network, other patients, and the facility staff. There are several ways for patients to participate. What we ask is that you find the way which supports you the most. Patients can participate in person. This would be coming to the facility outside of your dialysis treatment time and meeting with the team in the conference room or any other designated space where they have their monthly QAPI meeting. Patients can join on the telephone or teleconference. If you have access to a laptop or computer, you can join via any of these platforms, Zoom, WebEx, Google Meet, FaceTime, Duo, or WhatsApp. And due to the COVID pandemic, virtual options have become more robust and definitely one of the top ways patients become involved. If the QAPI meeting is going on while you're on treatment, there are patients who participate chairside. So during the monthly rounds with the doctor and the rest of the healthcare team, patients are still able to provide their input and have a voice. And lastly, if none of the previous options are able to work for you, patients can also provide a written report to give to the healthcare team and really discuss what is going on in the facility, any concerns, outcomes of any activities, and other facility happenings. If you are interested in being part of your facility's next QAPI meeting, talk with a member of the healthcare team about becoming involved. Tell them why it's important to you and why you want to participate. Download and print the Help Patients Understand Their Role in Quality Assessment and Performance Improvement Checklist. You can also ask a member of the healthcare team to download and print it as well. Review it with your facility and use it as a guide to prepare for the next meeting. The resource shown here, Because Your Voice Matters, was created for patients by other patients. This is a great resource if you want to share it with other patients about QAPI meetings and encourage them to become more involved. It gives a quick outline of what to expect before, during, and after the meeting, and it has space for you to take notes during the meeting as well, to record discussion topics, any follow-up items, and results of what happened at the meeting. So what do you do if your facility is not on board? It is not unusual for a facility to not want to include patients in QAPI. Many facilities are afraid of two things. First and foremost, patient confidentiality. Facilities have expressed concern about patient information being disclosed in front of other patients. And also, the ongoing COVID-19 pandemic. We encourage you to talk to your facility manager or social worker and review the resources provided in this presentation. You may also contact your ESRD network for assistance and additional resources. For additional information or any questions you may have, you can contact your respected ESRD network via the toll-free patient line. On this presentation, you can see it has a yellow star highlighted next to it. Thank you, and that concludes this presentation, How to Become Involved in Your Facility's QAPI Meeting.